Welcome everyone. It's really good to see so many people joining us today on our open session for vets on Brachycephalic Ocular Syndrome. Thank you very much for joining us this evening. Before we start, I want to let everyone know that this session is being recorded. Please also keep an eye on the chat box where we will share a link for you to register your attendance and to receive your certificate of attendance at the end of the session. My name is Beth Dunn and I'm one of the program tutors. I'm the program tutor for the Small Animal Ophthalmology Distance Learning Programme at Improve. With me tonight, I have Charlotte French, Head of Curriculum and Quality and the Operational Head of the UK, USA and Nordics, Kate Kostaros, Digital Learning Coordinator, and Pedro Malho, a European MRCV specialist in veterinary ophthalmology. This evening, we're going to start with an overview of our Small Animal Ophthalmology Distance Learning Programme, including a quick demonstration of one of our interactive lessons. After this, we will be turning our attention to our talk for the evening. Pedro Malho, the course director and one of the authors of the Small Animal Ophthalmology Programme, will share his knowledge on Brachycephalic Ocular Syndrome. We'll be taking questions via the chat box, and at the end of the session, there'll be an opportunity for you to ask questions about the ophthalmology programme and to ask Pedro questions about his presentation. There'll be a link added to the chat box for you to enter your email and to receive your CPD certificate after the session. So to start, Charlotte will be giving you a brief overview of Improve International.
Thanks very much, Beth, and good evening, everyone. Some of you will be familiar with Improve, but for those who are not, we thought it would be quite helpful to give you just a little bit of a brief introduction. So Improve has been providing CPD to veterinary professionals globally for over 20 years and was the originator of modular CPD. We are continually adapting and innovating our teaching and learning style from face-to-face lectures and practical training to the more recent online programs. We are a truly global company and it's just fantastic to see participants to this webinar from across the globe. And we offer CPD in countries as varied as Japan, China, Australia, and many European countries. In 2020, we delivered over 400 different CPD courses, providing over 1,000 days of training to the profession. Improve was created by a group of vets passionate about delivering high quality continuing education to the profession, and this is still the case today. By studying with us, you will take back to practice new skills, knowledge, enthusiasm, and the confidence to handle those challenging clinical scenarios. Our programs are accredited by ISVPS, the International School of Veterinary Postgraduate Studies, and validated by Harper Adams University. Throughout the programs, you can start working towards a recognized qualification. This might be the General Practitioner Certificate, which is awarded by ISVPS, who have already globally awarded more than 5,000 vets with a GP cert. Or by completing additional assignments, you could achieve the PGC award from Harper Adams University in the UK. The PGC in small animal ophthalmology is an eligible entry qualification for advanced practitioner status with the RCVS in the UK. For those of you in the USA, race accreditation is pending on this program, and all of our online courses have received race accreditation. This course will give you 168 CE credits. Thank you for listening, and I'm now going to pass to Kate Kostaros, who is going to give you a brief overview of the programme, followed by a short demonstration on our learning management platform.
Thank you, Charlotte. So my name's Kate, and I'm actually the digital learning coordinator for this programme and some of the other ones. I myself did the small animal medicine certificate with Improve, so I'm really happy to be working with them now on this kind of exciting new area of the business. So essentially, we've started to develop these online learning programs, really to give people the option of either attending face-to-face courses to gain further knowledge and qualifications, or something that people can do from wherever they are in the world, from the comfort of their own homes, and in a slightly different learning style to suit those people that don't sort of learn just from sitting and listening to lectures. And all the online programs have been developed using our world-leading innovative learning management platform. The entire course is developed by veterinary specialists, and each module tutor supports every session via an online forum. So you have contact with the specialist for each module that they're live. And the content's delivered in a really intuitive and engaging format. And for being online, it sort of allows you to gain that all-elusive work-life balance. You can fit your studies in around busy practice commitments. The small animal ophthalmology course starts on the 1st of September this year and runs until the end of January 2023, but there will be reruns on each year. The course covers 14 modules over 17 months. You do get August and December off, so easy to take some holidays at some point, but it does give you that time to catch up on content, review learning, and consolidate it. So in these 14 modules, it literally covers a complete range of ophthalmic topics, right from the initial examination through to the embryology of the eye, the cornea, looking at neuro-ophthalmology and comparative ophthalmology, as well as surgical modules to really hone your skills. At the end of the sort of modular online course, you also have the option to partake in a 3-day practical session. And that covers everything from the examination of the eye through to ophthalmic surgery. 9 veterinary specialists have contributed to this programme, and obviously they each bring with them a vast range of experience and knowledge. So our world-leading distance learning platform really does provide a unique environment in which you can learn. The content is interactive, custom-made, and it's a whole new digital approach to learning. So I'm just going to really briefly show you how it works. So here on the screen, you can see this is actually a sort of screenshot from what you would see on the learning platform. And this is actually taken from our small animal medicine program, the ophthalmology module. And here you can see each module has a module introduction, which is a video by the specialist introducing themselves and the module. And then the content is split up into 3 weeks, and the final week is 2 case studies. Within each week, there are 3 lessons for you to complete. And as you can see in sort of the little bottom left-hand corner of each box, there's actually also a progress bar, sorry, so you know how far through each week you are, and obviously you can see when you're 100% complete. And we also have extra sort of notes in a sort of PDF format that you can print out, as well as summary videos after each week where the specialist will give you a little one-to-one clip of kind of really key points that they hope you've taken away and little extra nuggets of information. We've also got access to the discussion forum, which is really valuable. It's a great chance to interact with your peers, discuss cases, and obviously this is where you also have access to the specialist who has authored that module. So you can discuss any cases with them, seek advice, and obviously they'll engage with you and give you little cases to discuss and things like that. So although it's distance, you still do have that connection with your peers and with the specialists. And obviously people that have done this course for small animal medicine and small animal surgery have actually found that they've made great connections globally with their colleagues. And it's a great place to kind of safely discuss cases in that environment. So I'm just going to briefly in a moment share my screen. And what I'll do is I will show you. Bear with me for some reason. Sorry, Steph, if you're there, the share screen button's disappeared from my screen.
I'll just resolve that for you, Kate.
Brilliant, thanks. So I'm just gonna, in a moment, just briefly chat through with you how to sort of what one of these lessons looks like, so we can sort of review that for you. The lessons are essentially largely in a text-based format, but we do have interactivities along the way. So that has both videos, the sort of short snippets, because obviously ophthalmology is quite a visual sort of topic to learn about. We have diagrams for you to label. We've got models of the eye for you to look at in 3D. Obviously, with eyes, in particular, because it's something that's really case-based, we do require that sort of we're constantly learning that information and working on it. So throughout the course, even from the very start, you are given sort of cases to work through. So even though you might not have sort of learned all the knowledge yet, we're sort of trickling that information in for you. Thanks very much, Steph. So this is just an example of a lesson and how they look. So effectively, you can see the contents page of the lesson at the beginning. You click begin, and you're automatically given an introduction from the module author, along with the learning objectives for that lesson. Down the left-hand side, we're given a contents page. So that's where you can see everything that's included in the lesson. And at the end, there's always a little end of lesson quiz with about 3 multiple choice questions. It's not examined, but it's really just to test your knowledge and check if you need to go back and review everything. Now, the clever part of this all is that you've got a progress bar that saves where you left off. So automatically, when you go back into the lesson, it will start you off where you left. So it really is helpful for kind of, if you're on your lunch break, you can just flick in and out, do a section, cooking dinner, you can do a little bit. You don't have to complete the whole lesson all in one go. And I'll just kind of, for example, show you a section. So the lessons are sort of formatted in a kind of vertical manner for you to scroll down. And this does work in a variety of formats. So you can use it on smart devices as well, iPads, as well as having laptops. And you can just scroll down the content. There's images along the way. And as we'll show you in a moment, there's also interactivities for you to do. So I'll just flick here to show you. We've got little video clips demonstrating, in this case, it's a clinical exam of the eye. And we've also got these little sort of cases along the way, like I discussed. So it's a chance for you to really examine the eye, look at it, and then we can reveal what the specialist's answers are. So we've got little quizzes like that along the way for you to work through, as well as things like multiple choice questions. When you select the answer, you're automatically given whether it's correct or not. And other such things like interactivities with pictures, and drag and drop options as well. So there's things about labeling diagrams, etc. So we've really tried to make the format of learning really engaging. It's not just reading boring text, it's actually engaging you with the learning. It's getting you involved with it. So I think it's absolutely fantastic form of learning, and something that's a little bit different and quite new. And what's great about the quizzes, that I personally did kind of a face-to-face course, but I think what this does is, obviously when you come to revise, if you decide to take the exams at the end, you have access to all these lessons. You can flick back through and just go through and do all these little quizzes along the way, which really makes it a great tool for revising as well, and reviewing back on those subject matters. So apologies for that little technical glitch earlier. Without further ado, I'll hand you over to Pedro in a moment. So obviously this evening he's going to be talking about Brachycephalic Ocular Syndrome. And he is the course director for the Ophthalmology online distance learning program, and he is also authoring a couple of these modules. So really excited to hear him speak this evening. Don't forget, in the chat box, you can post any questions about either the course or questions that you'd like Pedro to answer. And at the end of this session, what we'll do is we'll post the CPD certificate link, so you can pop in there. And obviously any questions we'll go through with Pedro as well. So I'm just going to stop my screen share in a moment, and I'll be handing briefly back over to Steph so she can allow Pedro to share screen. So if you bear with us one moment.
Hello, everyone. Hello, everyone. I hope you can hear me. I'm very excited to be presenting this evening. I am also very proud to be the course director of this online modular teaching program from Improve International. And I think Kate and Charlotte have said most of the things about this program. We do work on the background to make sure that everything works perfectly and you have the best and the most updated knowledge about ophthalmology for those that want to take this course from the comfort of their home or practice or whenever they want. My name is Pedro. My full name is Pedro Malho. I'm a diplomate from the European College of Veterinary Ophthalmologists. And I currently work at a referral hospital based in Derby in the UK. The name is a private veterinary centre. I'm also a teacher for the University of Nottingham. When we do at the same hospital, we do the classes and the practicals for the last year students of veterinary students. But obviously in my area of expertise, the veterinary ophthalmology. So I decided today to talk about the Brachycephalic Ocular Syndrome. It seems to be a very current issue at the moment, particularly when you look at the statistics of the Kennel Club, the English, in this case, the British Kennel Club, and we look into the registered puppies every year and the breeds that are registered in the UK. And I do feel that the trend is the same elsewhere. So we do have more and more brachycephalic dogs that are becoming more and more common. And also, what I wanted to say that this is not only to do with the eyes. We're going first to see what is a brachycephalic really, and we're going to talk about all the implications of their conformation. So the brachycephalic dogs, as the term means, brachys is a shortened head. The cephalic means head, and it is becoming an issue and a health issue, but also the fact that it's been so popular. And I commute to work by train, and this is an authentic advert for the train station. The train station. The train company doesn't exist anymore, so this is not from this year. But anyway, what I wanted to say is that they do use these breeds that have this puppy face, that they have this more human feel about their face to engage with people and to promote and to do marketing. And this is obviously leads to these breeds becoming more and more popular. And this is what we're going to see today, their prevalence, their popularity, but also the problems that this raises in the breed. So these breeds that are so popular, we have the most common, not the most common, but within them we have the English Bulldog, we have the Boston Terrier, the Frenchies, the French Bulldog, the Pug, the Chihuahua, but many, many more like the Boxer and the Shih Tzu. There are plenty of dog breeds out there that have a very short nose, a very flat face, and obviously this brings issues with the conformation of the eyes. So the most common issue that we see in the practice, that in the general practice, would be a brachycephalic obstructive airway syndrome. That this is when we have these brachycephalic breeds, we do have orthopedic abnormalities besides the airway obstructive. We do have cardiac conditions, and we also have dermatologic conditions, particularly at the ears. But from my point of view, and that is what interests us today, me being an ophthalmologist, is the ocular implications of the brachycephalic conformation. So it is interesting that there are certain correlations between also the conformation of the nostrils, as we all know, in the pugs and French bulldogs and the bulldogs itself, that they can correlate with significant and clinical brachycephalic obstructal airway syndrome, or in this, I mean, clinical signs from the presentation of the nostrils only, but also the clinical or the body score, and also the neck girth ratio. So how big the dog is also important in having issues by being a brachycephalic. So we have two folds of problems. We have two types of problems. We have an increased popularity of the breed, but we also have, sorry, I just want to remove this, but we also have the worsening of these features. So not only these breeds are very popular, becoming more popular, also the breeders tend to get even more brachycephalics every year. So one of the reasons for the increased popularity of the brachycephalic breeds is that a lot of people, a lot of football stars, TV presenters, actors do get these breeds, and we do see them in social media, and we do see them on TV. And we have, for instance, the classic from the French Bulldog, from the David and Victoria Beckham, but we also have others that are not, that I didn't put it here, such as the Paris Hilton famous Chihuahua. So this creates a market for the popularity. So this is one of the explanations, and this can be seen on the Kennel Club. Only in Britain we can see this, because I do have the numbers of the registered puppies every year, and this is just a chart, just a graph from 2008 to 2017. I did have a look at the breeds from the 2020, and we do have from 2008 to 2017, we do have a decrease of the Cavalier King Charles Spaniel popularity. We can see it here that we have a decrease from what in 2008 we have 11,000 registered puppies, but we have 3,500 in 2017. This continues to decrease, and we're going to see one of the reasons for this to decrease. And also the Pekingese has decreased, but it remains in 2020 more or less the same values. But then when you look at the pug, we've seen that this popularity becomes a real issue when you see more and more pugs coming through the practice since 2008, when we have 4,400 registered in 2008, but then we have nearly 11,000 in 2017 registered puppies. This number, fortunately, in 2020 is decreasing for pugs, but the same cannot be said for the bulldog. The French bulldog that is over there. So we have in 2008 we have a very not that common or not very popular French bulldog, and then we have a steady increase, like exponential increase of the breed popularity to 30,000 individuals being registered on the 2017 year alone. And 2020, I would expect this value to stay stable and to have decreased, but the 2020 values are actually 39,000 French bulldogs being registered last year alone. This means that although certain breeds are not as popular as before, we are also, obviously, talking about brachycephalics. These are public data. You can go into the Kennel Club website and find these values, as I did yesterday for today's talk about 2020. But the fact is that I was expecting to have a decrease of the brachycephalic breeds. We have this spike and then starting to decrease by all these, all these sensibilization campaigns that have been made to put owners away from these breeds because of their problems. But unfortunately, that has worked for certain breeds, such as the Cavalier King Charles, probably associated with other issues such as syringomyelia that people are becoming more and more aware that can be an issue with that breed. But English bulldogs and French bulldogs particularly, they are still growing their numbers of registered breeds or registered puppies. The other thing that I want to say is that this is only dogs that have been registered officially. This doesn't really track those puppies that are not being, those puppies are not being registered or are not from official recognized kennel club breeders. So, as I said before, this situation, this issue with the brachycephalics is twofold. One is because they're becoming more and more popular despite all these sensibilization campaigns that we have to try to limit and to try to make aware the owners that this may not be the best breed to have, or at least, and to acknowledge or to make the breeders aware that the brachycephalic features are not, they are desirable by a market that has been created, but they're not desirable from the point of view of the health of the dogs. So twofold, the brachycephalic features have been deteriorated as well, or being exacerbated with time. And when you look into museum skulls from 50 years ago, we've seen how the English bulldog looked like, that had a proper nose, and you can see how it's been progressed. And you can see also the shape of the eye that is less, and the orbit becomes less and less, smaller, I guess, and the globe becomes more exposed. And this is only in a 50 years time. So to fight this and to tackle this issue, BSAVA and the BVA Association in the UK, they set up a 10-point plan for the veterinary practice, and this is something we can do in first opinion, and not only first opinion, but it's something that we need to do with the owners and breeders of dogs, of brachycephalic dogs. And one is so any owner that speaks about or talks to you about, or that is planning to get a dog and is planning to get a brachycephalic dog, we could offer a pre-purchase consultation. We can kind of advise, really, try to give advice to the owners what they are getting into. Also advise against breeding any dogs that we see in practice that already have issues with airways, and also making sure that snorting or snoring at night, or even during the day, or having issues in the warm weather is not actually normal for any animal. So this shouldn't be taken as a normal condition, or not. This shouldn't be seen as a normal feature for that breed, because it's not. And also any surgery that requires that alters the conformation of the dog, such as we're going to talk about that in the future, and even cesarean C-sections for the dogs should be reported to a proactive kennel club, so that we know that particular individual has certain features of BOAs, or have breathing difficulties, and even when he was reproducing, when we were crossing this dog, we even had to do a C-section, because this is important in the future to choose breeders, to choose dogs that we're going to breed from. Also, there is certain things that are specific for the UK. So certain things that are being promoted as the puppy contract. It doesn't really apply to all countries, and I am aware that I have a worldwide audience today, but it is basically a plan to try to inform the owners when they buy the puppy for certain issues that they can have with basically quality control when they get a puppy from a certified breeder. Also, health schemes can be promoted, promoting, encourage, making a puppy to see eye conditions, or I had to see a specialist to have a more proactive approach to any conformation issue. And this is being established by most of the breed clubs. Also, when we see in our routine boosters, routine vaccinations, to have exercise tolerance tests to see if they cope with the weather, if they cope with exercise, and try to grade this the function of the dog during this time. This can be done at the practice. Other things is to make sure that your practice share the data from their brachycephalic dogs with other practice, and ideally with a national entity that puts together all the problems that you have seen in brachycephalic dogs. When I mean that, it could be through the breed clubs. In UK, we have the Vet Compass, that is basically a way of gathering data from diseases or for conditions in the animals in the UK, not only the brachycephalics. Also develop try to put owners off by getting these brachycephalic conformation dogs, just trying to avoid any type of cute dogs that are brachycephalics, try to avoid the use of brachycephalics in adverts, information, or for marketing purposes, and also try to explain to the owners what problems they may have by getting one of such dogs. And also, one of the things that is very important is most of the times the owner doesn't really listen what we say in the consult room, so it's also good also to have our staff trained to quickly and swiftly give an advice about brachycephalic dogs when the owners just mention that, when he's talking to the nurse, the assistants, or he's paying with the receptionist, just to mention, well, be careful, they also are very prone. We had one yesterday that had the same issue. This is really important to make sure that we we don't want to extinct these dogs. We just want them to have less problems and to try to prevent this slope of problems that we're having now, that is to do with increased brachycephalic features. So also the vets should also be involved with the breeders. I know sometimes it's not very easy, because breeders know that if they have a brachycephalic dog, they will probably sell more. But then on the other side, the vets are there to fix the problems. These problems that are fixed, conformation problems, then should be passed on to the breed club or to the kennel club to make sure that that line is affected by certain conditions. Particularly if you do entropium surgery, then report to the kennel club, so the kennel club knows that that dog has potentially an inherited condition. Right. Okay. So this is all to do with brachycephalic dogs, all the things that they can have from, as we've seen, orthopedic problems, boas, that is the most classic. But what I see, when they have ear infections, I tend to see ears as well. Not, they don't come for me for the ears, but I look at the ears as part of the ophthalmic examination. Just because obviously if you have an ear infection, ears can harbor some bacteria that they can migrate to the eye, and they can become a problem. So let's talk about what's happening with the brachycephalic eyes specifically. So everyone knows this. We see this all the time. We know that the brachycephalics, due to their conformation, their skull conformation, they have a shallow orbit, and they have this breed-related exophthalmos. There is not enough room for the globe of the normal size. The ocular globe, is the same size as a Labrador. It just doesn't have room. So it will be more exposed and prone to have exposure related conditions. So if you have a fissure at the eye, the palpebral or the eyelids are too long, they don't really close. And when they don't really close, we have what we call lag ophthalmos. Some of these dogs, one of the classic question that you can have or you can do to owners is if they sleep, well, most of them all snore, I know that. But if, again, that shouldn't happen. But if they sleep with the eyes open, then you can tell by looking at the chronic pigmentation that depositing in this axial or the horizontal line of the eye, just because that area is not lubricated during the night. So lag ophthalmos, the inability to fully or completely close the eyelids, macro palpebral fissure, so it's enlargement, so the eyelids are too big and don't cover the all sclera. You can see this is another feature of brachycephalic, is that when you see sclera, it just resembles a human eye, because we can see sclera in our own eyes. When you talk to someone, you're looking at the sclera. Nowadays, with using masks, you only see the eyes really, and you look at the sclera, you look at the small cornea. So brachycephalics, by having this macro palpebral fissure, you do see sclera as well. So that's one of the reasons why they look a little bit more human, how they look at you. So because of all of this, they have this too much skin for the bone conformation. They also have an entropium. So there is an inward rotation of the medial canthus. You can see it here as well. There is an inward, you can see the hairs there. So the skin on this part of the eye rotates inwards and pokes on the cornea, and it pokes on the sclera every time the dog moves the eyeball. So this also, because is the area where the lacrimal puncta is, and also where the tears leave the eye, because of this entropium, this rotation, the entry or the entrance for the puncta is mechanically blocked. So we also have this overflow of tears as well. Here on this dog, you can also see that the nasal skin fold is too big. They always have nasal skin fold, and it's not our goal to remove them, because that's what makes a pug a pug. But because of their short nose, there is sometimes too much skin. And this too much skin is sometimes the skin itself that pokes the eye, sometimes is the hairs that find the way to the eye. So we need to be aware of that as well. And we do have corneal pigmentation. The corneal pigmentation is not necessarily, it's basically a clinical sign. Is not creating an issue there, but it tells you that this is a chronic condition and there is a chronic exposure. So basically pigmentation means chronicity. We can also have hairs from the carunculus, so the corner of the eye may have hairs as well. They don't have where to go. They just poke the eyeball because of the conformation of the skull. And we can also have, this is a bit more difficult to explain, but this makes a bit sense, is that tear production is driven by your corneal sensitivity. So because of brachycephalics they have developed during all these years a lack or a decrease of corneal sensation because of their exposure. So if you have an exposed eye, you can't really feel everything. Otherwise, you would have your eyes shut all the time. So because they don't feel much, their tear production is also decreased. It's not as normal as it should be. And also their quality is also not as normal as it should be, because they're more exposure than a normal dog. So yes, I mentioned reduced corneal sensitivity. It's here as well. It's classic. It happens both in dogs and cats. Normally, brachycephalic dogs and cats with eyeballs that are exposed, they don't feel as much. This is a way of testing. Basically, you can test with other ways, with a cotton ball or a cotton thread. You can poke on the eye, in the corner of the eye, because if the dog sees you coming from the front, you would see it. So you don't know if he's feeling it or if he's seeing, because he will blink. But that is a way, a yes or no answer doesn't really grade it. For us to grade how much the corneal sensitivity has been decreased or reduced, then we can use this little machine or instrument that is called a crochet bonnet. This tensiometer basically measures how much the dog can feel. It has this nylon filament, and you decrease the nylon length, then you know that the shorter the filament, the stiffer the filament will be. So the good thing is to feel with a very long filament. So you have a better sensation or better sensitivity of the cornea if you can feel with a very long nylon filament. Right. So what is the clinical relevance of this conformation? So we've seen with we know when they are overweight, the issues that you can have with their breathing, orthopedics, heart problems. But the problem for the eyes is that this conformation can lead to corneal erosions and mostly ulceration. In fact, this is an interesting paper that came out in UK, and this was a paper that was put up by a lot of practices in UK that collate all their data into Vet Compass, and then there was O'Neill and Tal and their collaborators. What they found is that they put together all of these dogs that people see in practice, and they found out that they class it by breed, and they found out that most the dogs, and this is really no surprise, but they just mentioned that they have numbers for it, is that brachycephalic dogs can be affected as high as 11 times more. So the probability of having a corneal ulceration is 11 times more than a crossbreed. So this is what we normally see. We normally hear some owners say, oh, the crossbreeds don't have any condition. Well, we do even use them for comparison. And the fact is, a crossbreed that has no brachycephalic features has 11 times less probability of having a corneal ulcer erosion than a brachycephalic. And I'm saying this because they put the brachycephalics all together, because the pug itself has 15 times more the chances of getting a corneal ulceration. So no wonder that we as ophthalmologists see much more brachycephalics than any other breeds. This probably is, well, getting rid of the brachycephalics will probably be the end of business for ophthalmologists, but we don't really want to see unnecessarily problems, particularly because of conformation issues, okay? So also we can have pigmentary keratitis. So pigmentary keratitis is the deposition of pigment and that results in inflammation. Corneal pigmentation. So corneal pigmentation, there is no inflammation involved, it's just the pigmentation. And I have to say that we should say pigmentation and not corneal melanosis, because melanosis implies that you know that it's melanin. Yes, I'm sure there is, most of them have melanin, but technically, if you want to be, if you are academic about it, you can't really call melanin without knowing if it is melanin, if you don't have a biopsy of the cornea that you don't need. Because there are other pigments, adrenochromes or iron, that can stain the cornea. So corneal pigmentation, there is different patterns that we can have. We can have a keratopathy called vortex pigmentary keratopathy that creates this whirl appearance that happens both in dogs and in humans. Is basically comes from the periphery, from the limbal area, and reaches the center of the eye, sometimes to the left, to the right, sometimes. So it gives these nice pictures, but basically it tells you there is something wrong with there's a surface disease. You can have corneal fibrosis. Corneal fibrosis then look a little bit more whitish. You can actually see a little bit around it. Most people tend to focus or to stay with the pigment. And another issue with the brachycephalic conformation is that the whole globe can even pop out of the socket of the orbit, and this needs to be corrected straight away. Right, so things can be as bad as this little fella here. You can see that you can see a lot of sclera. You can see the divert axis of the visual axis, exotropia. We have a very long eyelids, and we have a nasal fold. So these dogs, we do need to decrease the exposure of these eyeballs, and usually we do this by decreasing the medial entropium, removing the trichiasis as well, and the lacrimal, and trying to keep the lacrimal puncta for drainage, but also by controlling the entropium, we are hopefully controlling as well the restoring the drainage. Okay, so as I said, and now the main thing as well is to try to prevent the pigmentation and hopefully decrease the pigmentation in the future. Let me just see some of, okay, we can address some of these questions later. Right. All right, let's go. Okay, so medial canthoplasty is one of the ways we can actually do a lateral canthoplasty as well, but medial canthoplasty is usually one of the ways that we can have to decrease the exposure of these eyeballs on the medial aspect of the globe. But also another benefit from doing that is that by doing a medial canthoplasty, you're actually moving the medial canthus a little bit further to the lateral aspect, and you're also protecting the eyeball from the nasal skin fold. So you are basically treating with twofold. Okay, right, surgical techniques to do this. Yes, we can do the pocket techniques called the Roberts and Jensen technique. We can have the medial canthoplasty to decrease the palpebral fissure, and we can also have the Algover's medial canthoplasty that we're going to see in a moment. So what is important is that you always need to address the lower eyelid medial canthal entropium, not only the corner, but sometimes you need to decide if you're going to do the nasal skin fold reduction. It's not removing completely, but reduce the size of the nasal skin fold. And this can be done by actually observing how much of this nasal fold is putting weight on the lower eyelid. So if that is the case, if it's putting some weight, then you do need to remove the nasal skin. Well, reduce, not remove, you can't, it's too much skin, but decrease the amount of the nasal skin, and hopefully decreasing the amount of skin that can rub on the corneal surface. So regarding the pocket technique, it's not, I shouldn't say it is the most common one that we do, but basically you need to create a pocket you need to split the eyelid margin 2 millimeters to the upper and lower lacrimal puncta. You need to open and try to get to 15 millimeters, 1.5 centimeters deep, creating deep this pocket. And after that, what you need to do is to cut one of these corners, and that releases a little bit of conjunctiva, tarsoconjunctiva, that you're going to slide into. Here it is, and you're going to slide into the pocket that you've done ventrally. And you can use here, you can use non-resorbable suture, 4-0 suture if you want, but eventually you need to remove these stitches. It does create a new canthus. That's what we want to do. We want to create a new canthus here. Then you need to close the skin here, and it gives more strength to the canthus because you changing the way that the tarsoconjunctiva is being directed. But I have to say it's not really the most common technique. This is a little bit more common, is basically to remove the old canthus without doing that pocket version and suturing. I normally use a figure of 8 here, and you can remove all this tissue. You are decreasing the overall length of the palpebral fissure, and if there are any hairs here from the nasal skin fold, they will be away from the cornea. Okay? So these techniques that we discussed, they don't actually contemplate the medial canthus. The medial lower eyelid entropium. So you do need to remove a little bit of skin here in these brachycephalics, because this would be for a non-brachycephalic breed. This is just a description of the medial canthoplasty, not necessarily what the old thing that we need to do for our brachycephalics. So you can combine it with the lateral canthoplasty. It is also a very simple technique. You can do it on the medial canthus and then on the lateral canthus. Basically, you remove the eyelid margin, and then you carry on until the canthus, and you remove from the other side as well. And then by suturing it, this will stay together. Although it doesn't have the same strength that we discussed with the previous pocket technique, but it would do the trick. Sometimes we do this in cats, the lateral canthoplasty, but the most common technique then will probably be the Algover medieval canthoplasty or the modifications thereof. So it's a little bit, so basically what it does, it combines a medial canthoplasty with an entropium surgery. So here you remove this corner of the eye. You need to do a new corner. Keep in mind that this area here and this area here will be the new corners, yeah? And with this technique, Dr. Algover also removes a little bit of this area of the caruncula, and then at the end, she cuts the entropium or the excess of skin on the lower middle eyelid and sutures all together. So I do have a video here that we can see, so that Dr. Algover gently provided to me. So what we have here is she first finds the upper and lower lacrimal puncta, and she uses a nylon to provide some landmarks, to give some landmarks, and then she starts doing the surgery. Let's see how the video works. So you do have trying to do this cut here. Yeah. And then the other thing, I just want to stop a little bit there. The other thing that he does, so doing this cut, this initial cut here, and then what Dr. Ingrid does is she follows the canaliculus, and so that the goal is to keep the opening of the canaliculus deeper, yeah, over there. and that's what was done here. Okay, so we do have, so it's following, puts the scissors into the lacrimal canalicula here again, and they meet there, yeah? So this is just the first step. She doesn't need that. She knows now the opening of the lacrimal punctures are deep into the, then she cuts the eyelids, the eyelid corner. She joins them together. Yeah. And, okay, joins together. This is a new corner. Well, not here. The new corner is over that one and that one. Okay, you can see now on the suturing. Normally in a 2-layer pattern. Yeah, and then we're going to see a little bit. Okay, this, I have to stress that this needs to be, it looks easy, but it does need to be, the ends need to be very well aligned. Okay, this is going to be the new corner of the eye. But this would be a middle canthoplasty only. And what we need to do next, and the video will show that, is removal of the excess skin on the, here we go. You know, I'll probably take some measurements before, but Ingrid does know what she's doing. And then suturing all together, yeah? So that relieves the tension, relieves the skin on the medial. This is the nasal fold, yeah? This removes the excess of skin on the medial canthus. And here we go. Okay, I'm just going to go back so you can see what was done, yeah? So finding both, they probably are a bit more here, and then cutting them so that they will go deeper into the conjunctiva, cutting the skin, meeting here, and this area, this one and this one, will going to be the new corner. Caruncula gone, and then she cut this area and she just suture it routinely. So this is a way of doing it. And now we're going to see a clinical case. So this is as bad as we can see in practice. So we do have a very big nasal skin fold. We do have pigmentation, blood vessels, quite active. So we do have a pigmentary keratitis. We do have a low eyelid entropium here. Low eyelid entropium. Scleral show, so lag of thalamus. And we do have, again, blood vessels for those that haven't seen yet, and the nasal fold. So this is, so for us to address this case, that is, I have to say that this owner didn't really want to do anything, I do remember. But particularly because she went online and she went on the internet and she found the horrible pictures, what I described, and then anyway. He eventually decided to go ahead. No owner is very pleased when we say that we're going to change nasal folds. I don't know why, maybe that's probably, we're going to change the old dog really, but the nasal folds seem to be a little bit more a tricky spot. So we did this combination, so middle canthoplasty as you described, modified Otto-Salz's technique. So a combination of the two techniques that I've shown before. Then we decreased the nasal fold, which is very simple. And then we started with cyclosporin ointment, Optimmune once daily. The dog wasn't very easy to give medication. He wasn't aggressive, but she wasn't very easy to give medication. So the owner used the cyclosporin only once daily. And this, so this is after the surgery, so 6 months after the surgery. So you can see that you have a new corner here. You see less and less sclera, and there is no blood vessels. Yeah, there's probably here a bit there, a big one, but those blood vessels here mainly. And the pigmentation is withdrawing, okay? Nasal fold is still here, although I reduced the size of it, but not all of it. There is no entropium, there's no hairs there, and the new corner. So 18 months after surgery, so you see again, those blood vessels, the pigmentation gone, a complete new corner, less lag of thalamus, less microblepharum, and you have a smaller eyelid nasal skin fold. Yeah. So the problem with this corneal pigmentation is they can blind them. So we need to address the underlying causes of the pigmentation, because as I mentioned before, it is a clinical sign. It's not necessarily, is basically is telling you that there is a problem and you need to sort out the underlying problem. Most of the times it's entropium, and you need to correct entropium, or you can have aberrant hair like ectopic cilia, distichiasis, or trichiasis, basically a hair that is poking the cornea and it shouldn't. We do have corneal exposure, again, due to conformation. We can't really change the skull, so we need to change the skin. And you can even have corneal pigmentation due to immune-mediated conditions. So we all know about this, so it's a bit out of the scope of the brachycephalic, and also keratoconjunctivitis sicca, and also a little bit away from the, off topic, but this is the main reasons for corneal pigmentation, and obviously as scarring tissue after a chronic corneal ulceration. So, but corneal pigmentation in brachycephalics seems to be very typical, because there was a study from 2013 that included, if I'm not mistaken, it was a lot of pugs. I don't want to say how, yeah, they were a lot of them. And they found that 82% of the pugs, they all have pigmentation on their eyes, one or the other or both. So they even graded like very mild corneal pigmentation, less than 25%, 25 to 50% of the pigmentation, and more than 50% of the corneal surface covered by pigmentation. So as you can tell, this is quite impairing. Well, this is but this is probably more impairing for the eyesight, because you do have a black spot and you don't really see very well. It's like trying to drive with mud on your windscreen, so that's probably no good. So with the amount of pugs that they followed or they examined, they distinguished between prevalence and severity. Okay, so one thing is which ones affected, and we know that these more than 80% did have pigmentation, but not all of them have the same degree. So they found that the prevalence was not associated with the pug color or the age or the conformation or the eyelid conformation, which was a little bit difficult to understand, or even the tear film abnormalities. The prevalence was only associated with the dog gender, and that found out that male dogs were more exposed, and then you were more prevalent. I guess that would be the correct wording. Severity is a bit different. So again, it was not associated with age, but dogs that were particularly male dogs and fawn dogs, so those light brown pugs, did have worse presentations. And also, and this makes a bit more sense, tear film abnormalities. If you have a tear film abnormality, then obviously you have more pigmentation than a dog that has normal tear film production and quality. So they named this because it was so prevalent, a keratopathy. Basically, it was pigment, very likely melanin, but a keratopathy was something that is in the breed and is very common. Another paper came along in 2017 and looked in confocal microscopy. Basically is laser-based pictures of the eye, so macro, very magnified pictures of in vivo corneas. And you can see here, you can see, so these three pictures are a normal non-pigmented cornea that we have, and this is all the epithelium. The confocal does have limitations in terms of depth. So this is a normal intermediate epithelial area. Then you have a basal area, and then you have a more deeper area of the cornea. Then here what you have is already so they are equivalent. In a dog that have corneal pigmentation already have pigment in their intermediate areas. Here he had, on the basal area, he had leukocytes, and has a very diffuse pigment deposition as well. So not only that, they also found that they have blood vessels as well, and pigmentation that migrated through the basal layer. So these authors, instead of thinking that we have a pigmentary keratopathy, they actually think that we have keratitis. So because if you have leukocytes and you have blood vessels, this is an inflammatory process. So this may be only wording, but you probably will start thinking, why don't you treat, if this is inflammatory, why don't you treat with anti-inflammatories instead of, you know, like steroids or non-steroidal anti-inflammatory medications? So we're going to look into that as well. So this is, they also found, what is interesting in this paper, also found that dogs that were normal, pugs that, you know, brachycephalic dogs that were normal, they also had the same features, but on the peripheral area. So there is definitely something abnormal in the brachycephalics, in brachycephalics corneas. This is what I said. So this may take, you know, these findings may change our view and our way of treating pigmentation in brachycephalic breeds. So, okay, we look into controlled underlying cause. This is terribly important. Distichiasis, anything to do with extra hairs, entropium, or dry eye. This is, we all know this. We can use long-term of topical cyclosporine. We can use Optimmune long-term. You've seen Elsie before, and she had a good result. Yes, has been reported to decrease the pigmentation, or at least keep the pigment at bay. And this is what I was saying. So from the initial presentation to 18 months presentation, so it looks quite clear and transparent. I have to say that because I think Elsie responded very well because he had blood vessels. So there was something active, you know, we could see the blood vessels. We don't need a confocal microscopy to see the blood vessels. We could see them with naked eye, really. And then I think he had responded better to the treatment, removing the underlying cause and treating with cyclosporine because of that. Some people argue that the use of tacrolimus is another option, although I know people that think that tacrolimus does have a better effect on the tear production, but not necessarily on removing the pigment. And then we come to the use of topical corticosteroids. So it's very tempting to use a steroid to remove all those blood vessels and remove all of that pigment. The thing is, I'm not entirely sure if we would remove the pigment. It will probably remove the blood vessels. And you can argue that the blood vessels brought the pigment with it. So if you remove the blood vessels, some of the pigment will leave. But the thing is, as you remember, these breeds have 11 times more probability of developing corneal ulceration compared to a crossbreed dog. So I wouldn't be very comfortable in giving topical steroids in a dog that will probably get a corneal ulceration and then come back with a melting ulcer and potentially even losing the eye. So I'm a little bit reluctant to use that, but you know, everyone has different options. Has been reported in literature treatment with cryosurgery, basically trying to freeze this pigment, because we are well aware that the pigment is not very, it doesn't deal very well with low temperatures, and because the cells that contain melanin, again, we are assuming it's melanin, but you know, probably a little bit academic, but these melanocytes that contain the melanin are rich in water, and they are very sensitive to freezing. So when we quickly freeze them has been reported in this paper from Hazolai, is that quick freezing the surface of the cornea, so using a frozen tip on the surface of the eye, you are actually killing these melanocytes containing melanin, and you are removing this pigment. The problem is that, as you might understand, this will create a lot of inflammation after that, and will attract blood vessels as well to the area. So this is usually a type of cryotherapy that is, or instrument that is used for skin, and they use 2 cycles, to freeze and thaw cycles of 50 seconds to remove the pigment, and they have used it in 16 corneas. So they also started on the areas that are more affected, and then they went to the edge of these lesions. The problem is that obviously if you remove these pigments by freezing and you get inflammation after that, you probably will get recurrence of the pigmentation. So I'm not really sure that all this treatment was worth it, particularly because you do need to anesthetize these dogs to achieve this. And 8 out of 16 eyes by day 60 had already pigmentation. The other thing is, and I need to say this, is the eyes that Azoulay used this treatment, they weren't this more benign approach, or this more benign pigmentation. They were dogs with dry eye, keratoconjunctivitis sicca, and also dogs that had chronic superficial keratitis, also known as PANUS. So there is not exactly the same dogs that I was mentioning before. So this is some pictures from Azoulay paper. So day 5, you can see, so all the, most of the pigment is gone. Day 15 looking great, compare how it looked like. And then 60 is, compared to the beginning, is pretty good. But keep in mind that it was labeled as a success for this case. So the other cases, the other dogs didn't go as well. So, and another dog, the same dog on day 300, then we have pigment coming back. Okay, but we can argue that he had probably 10 months that you could see pretty well from that eye. Okay, so this is out there, and this is one of the therapeutics or the ways of treating the corneal pigmentation that you can consider. So corneal pigmentation, again, as I said, we need to first remove and control the underlying causes. This is important. And then the way of treating it is, I've showed one, it's not 16 cases as Azoulay mentioned, it's one case only, but I have several like this. Probably not, they probably don't get not completely transparent ever, because we have seen that the corneas are not normal. But you can choose between one way of treating and the other way of treating it. Again, as a disclosure, Azoulay corneas were a little bit different from the LC pictures that I've shown. But this is the way of dealing with pigmentation in our brachycephalic breeds. Then we will need to address the underlying cause. We need to move to change the conformation of the eye and the eyelids, and also treat nasal fold if needed. I have to say that probably 20-25% of the cases have the nasal fold treated at the same time, but not all of them need it, okay? Not all of them. So what about cats? Cats do suffer from this as well. As probably you guys know, pigmentation is not a big thing in cats, but they can have issues with conformation as well. And the same thing that we discussed for the brachycephalic dogs is happening in brachycephalic cats as well. So we are increasing the features of brachycephalia in Persian cats, for instance. So we do need to be careful what we're doing with our animals, and to make sure that they are a bit, we keep them as healthy as possible. Right. Cats would be another day. So because there's always a lot of things to talk about cats. So I'm happy to attend any questions that you guys may have. So I'm going to go through here some of the questions that you guys, one of the questions I have here is, yes, so one of the questions is that if cryosurgery could result in ulcer or damage the cornea. Well, it does, because you are basically, what you do with cryosurgery is to try to remove the epithelial area where the melanocytes are. So yes, you do create a lot of pain as well. That's why they do need to be under general anesthetic, and you need to treat them as an ulceration. Yes, that's one of the issues of cryosurgery. Yeah. In terms of damaging the cornea, well, I have to say that as is described in the paper, in this Azulay paper, what they mention is there are 3 phases. He mentioned that there is the initial shock, the immediate phase that is responsible for the dying of the melanocytes due to their high water content. So the melanocytes die, so you get rid of the granules of melanin are dispersed, so you get rid of that. So that's phase 1. Phase 2 is because of the freezing of the cornea cancels the blood supply, and there is a vascular stasis. So that's phase 2. And then you have a late phase that is to do with an immune-mediated response to the release of the pigment, and the immune system removes part of the pigment. So that is what is described in the paper. But yes, you're right, it can make definitely an ulceration by removing the epithelium. That's the definition of an ulceration. Yeah.